In today's Eye on Health, we're talking about going red for women's heart health, like the Highmark building lit up in red all month long. But our next guests want us to be aware all year long, not just in February. We want to welcome Kim Leo, an AHN patient who suffered a massive heart attack known as the Widowmaker 8 years ago, and Dr. Valentina Ivanova, a cardiologist at AHN's Women's Heart Center, talking about the prevalence of heart disease in women, prevention, lifestyle changes, and also we're going to talk about Kim's very personal story. So thank you both for being here today.
Thank you for having us.
Yes, thank you for having us.
Kim, I want you to share your journey and what happened to you.
My symptoms came on me so very suddenly, very acute. I started my day like a normal day, got up, got ready for work, went to work. I was walking up the stairs to the second floor where my desk was, and I walked back to my desk and I had a raincoat on, and I went to untie the belt of my raincoat, and all of a sudden this extreme wave of nausea came over me. I felt so violently ill, and I remember thinking, what is happening? What is going on? Within seconds, I started to perspire and feel this tingling sensation in my chest, and I immediately knew that something was not right. So I got help right away from a first responder. They called 911 and they took me to a local hospital. And when I got there, when I was wheeled into the ER, I remember seeing this entire medical team, and I thought to myself, this is a little scary.
Right.
And what they said to me is that they were going to prep me for an emergency cardiac cath, and I said, okay. And that was the last recollection I had. Usually they will give you something to relax you. You are awake for the procedure. I was not, because that's when they diagnosed the 99% blockage of my left main artery.
Unbelievable. I mean, you're lucky to be alive.
I'm very blessed. I am very blessed and so fortunate to be alive. Yes, I am.
Dr. Ivanova, tell us a little bit about her symptoms, because like she mentioned, they're acute, and this is something that some women would experience if they were having a heart attack, and they may not know that that's exactly what it was.
Sure, exactly. That's why we're trying to raise awareness among women, because the symptoms might not be so typical as we used to, having excruciating chest pain, something that's kind of doesn't fit probably right. As Kim was saying, like acute perspiration that she experienced, nausea, so it's completely, seems like maybe more GI symptoms than even heart symptoms.
Right.
So that's why it's very important for women to know that anything abnormal that not you, and especially is happening to you very suddenly, means that you need to get checked and checked as soon as possible.
So I thought this was really interesting. More than 70% do not consider themselves at risk, but heart disease and stroke kills 1 in 3 women every year. Kim, in your case, you were doing everything right, you thought.
Yes, I always tried to lead a healthy lifestyle. I didn't smoke, exercise on a regular basis. Yes, tried to do all the right things to prevent that.
So then what do you do? I mean, if you're doing all the right things, how do you prevent this? What do you guys do at the health center or the heart center to help women?
Sure. When women come to our center, we just, at first we sit down and talk. There is typical risk factors, and right now more atypical risk factors that's more kind of geared towards the women. So definitely as a typical risk factors, we're trying to make sure about or ask patients about having hypertension, diagnosis and all control of the hypertension, high cholesterol level, smoking, obesity. Knowing your family history is very important. Being not sedentary is very important. But more symptoms that or risk factors that gears towards women would be pregnancies. What did you have during your pregnancies? How many pregnancies you had? How many kids, or you had twins or triplets? It's important. Any side effects during the pregnancies, early menopause and depression.
Wow.
So those are things that we really pay attention to now.
And those are things that affect many women, most women.
Especially, yes.
Right.
Yes.
Okay, well, thank you both. Thank you for sharing your story, Kim, and thanks for explaining more about the Heart Center.
Absolutely, and the message I have to all women is just listen to your body and take action, because it can be the difference between life and death.
Thank you.
And come and see us, and we'll help you get healthy.
Kim, I'm so happy that you got the care that you needed. And for more on heart health care and the AHN Women's Heart Center, go to PittsburghTodayLive.com. We have the link posted for you there. And keep watching for our Eye on Health series here on PTL. It happens on Wednesdays, brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network for your health.